How are sport injuries classified and managed? Ways to classify sport injuries. Injuries are a part of sport. They occur more frequently in contact sports such as football, but may also be the result of overuse caused by repetitive movements. Injuries can be classified in 5 ways: direct, indirect, overuse, soft tissue injury, and hard tissue injury. Direct injuries are caused by direct force generated from outside the body. They can cause fractures, dislocations, sprains, and bruises. Indirect injuries are caused by intrinsic force, that is, force within the body, the result of inadequate warm-up, ballistic movements, excessive movement, and fault in the execution of a skill. Soft tissue injuries include damage to muscle, tendons, ligaments, cartilage, skin, blood vessels, organs, and nerves. They are acute injuries, which occur suddenly, and chronic injuries, which are prolonged. Overuse injuries result from intense or unreasonable use of joints or body areas over a long period of time. Occur by repetitive running and high and low impact exercise. Hard tissue injuries are damage caused to bone and teeth. Soft tissue injuries. They're tears. A tear occurs when a tissue is excessively stretched or severed, such as sprains or strains. These can also be split up into 3 different grades: grade 1, grade 2, and grade 3. Their skin abrasions occur when a player falls on a dry, hard surface. The injury causes pain and shallow bleeding as a result of the skin being scraped. It can also lead to lacerations and blisters. Inflammatory response. When a soft tissue injury has occurred, it becomes inflamed and responds by activating a 3-step self-healing process. Hard tissue injuries. Fractures. Simple, closed fractures. The bone breaks but remains underneath the skin, or compound, open fracture. The bone breaks and protrudes through the skin. Dislocations. Damage to ligaments that have been stretched or ruptured. The common signs and symptoms include deformity and swelling, pain and tenderness, and loss of function. Assessment of injury. Toe taps is used to assess the extent of an injury, determine if a player is injured and can return to the field. Toe taps is an acronym that stands for talk, observe, touch, active movement, passive movement, and skills test. RISA. Management of soft tissue injuries requires the application of the RISA principle. RISA is an acronym that stands for rest, ice, compression, elevation, and referral. Let's summarize. Ways to classify sports injuries: direct, indirect, overuse, soft tissue injury, hard tissue injury. Soft tissue injuries can be a tear, skin abrasions, and result in the inflammatory response. Hard tissue injuries, fractures and dislocations, and finally, the assessment of injuries, toe taps and RISA. Now, please move on to the Google document and answer the following questions before the next class.